every time I do this presentation, I start with this slide because I know we always got new people. And it's important that we understand that, veterans are less than 1% of our population. And if those people weren't willing to stand up and man a post, we wouldn't have the country that we have. It's easy to take for granted the freedoms that we have and become complacent and forget that freedom is not free. I remember when I went to the VA for the first time, it was back in the year 2000. I didn't even know I had these benefits. Somebody who wasn't even a veteran told me about it. That's crazy because they didn't even prepare me for it when I got out of the Marine Corps. And I walked into or rather drove into the parking lot over at Bay Pines VA Medical Center, and I saw this sign, and it just made the hairs on the back of my neck stand up. The price of freedom is visible here. And it made me look around all of a sudden. And I started noticing the diversity, of people, men, women, different races, some in wheelchairs, some without limbs, some you can't even tell that they have issues. They look just downright healthy, and every combination thereof. And the one thing I noticed was that nobody there was pitying themselves. And it drives me nuts when I hear people complain. I had one guy one time started complaining that he couldn't do this, that, and the other thing. And I said, dude, there are people out there that don't have an arm or a leg or two, and they're working. And he says, yeah, who? I said, veterans. And so when you see a veteran, it's hard to see that they're a veteran unless they tell you or they're wearing something, because they're the average person that you meet at the supermarket, in the gas station, over at the insurance office, and everywhere in between. And because of those people, we get to live in the land of the free and the home of the brave. So today what we're going to do is we're going to discuss the 4 types of veterans and their unique needs. The first one is a veteran on VA healthcare benefits, veteran receiving disability, SSDI, the veteran with TRICARE for life and or the dependent on CHAMP VA, and then 100% service-connected permanently disabled veterans. So one thing you want to understand is that veterans, a lot of them are starting to get educated because of programs like what we do, but there's still a lot of them out there that don't understand it. They believe that VA benefits are insurance, and they are not. They believe they don't need Medicare because they have the VA, and many of them believe they're going to lose their VA benefits if they take Medicare. And finally, many believe the VA will pay for non-VA emergency care, and it will only do so in certain circumstances. And I don't think I got a slide in there for that now that I thought about this. So I want to mention that right now so I don't forget. So you have a veteran who is 100% service connected, doesn't matter where he or she goes. He can go into any emergency room and they will never pay a dime, because they are covered with their 100% disability. But every other veteran, whether they have a disability or not, what will determine whether or not they get stuck with a bill is going to be whether they were sent by the VA, which if it's an emergency, they're not going to be. Second, if what the reason that you're in that hospital is because of the disability you have, or it's being exacerbated by the disability that you have, then they're going to pay. But other than that, the only criteria is if any reasonable thinking individual would believe that his or her life, limb, or health were in danger, and the VA agrees with you. That's the caveat. Then they'll pay. So I'll give you an example that I always like to use. You went out and ate some tacos with a lot of beans, you got some chest pain, you run down to the emergency room, and they send the bill to the VA, because I tell all veterans, the minute you walk through that door, you say, I'm a veteran that goes to the VA, because you only got 72 hours to notify them. And the bill gets sent. Now it lands on the first person's desk, and this person says, well, I could see how, they might have thought they were having a heart attack because that pain there, okay, we'll pay. But the other person says, you kidding me? That was a burrito. We're not going to pay for that. And so you're at the whim of whoever gets that bill. There is no concrete rules on whether they agree with it or not. So, and they believe that if they go to that emergency room just because they're a veteran, they have nothing to worry about. And unfortunately, many veterans that now have to make payments on bills that they can't afford are learning that lesson the hard way. So, and finally, they don't want to have to pay $202.90. I mean, for many veterans, that's a make it or break it month because of $202.90, and they don't realize that there are ways around it. Obviously, with Part B givebacks, the Medicare savings programs, and so forth. And that's where we need to educate them on that. Okay. So let's start with what the VA says on their website, because, and they've updated it. So I've had to update my links and everything from my previous presentation because they're changing things on their website. So now that I love the fact that they did it as a fact. So the first question that I captured, because there was a lot of them that I thought was pertinent here, was, does my current health insurance status affect whether I can get VA health care? Okay. And I have resources that I gave Michael to make available to everybody. I'll show them at the end. So these are things that you want to just save on your computer for when you come across that veteran, you pull out what you need so you could send it to him or her. So the answer to that is no. Whether or not you have health insurance coverage does not affect the VA healthcare benefits you can get. So when a veteran tells you, well, I'm afraid I'm going to lose my VA healthcare if I take that Medicare, you pull out that handout, tell them click on this link, and you will see that it states right on the VA website that no, you will not lose your coverage, and it doesn't matter what other coverage you have. Your health care with the VA is separate, because when they become 65, they got Medicare because of the fact that they worked and paid taxes. But the VA health care benefits, that's a benefit they earn for their service. So one is for service, the other one is for working, and they don't talk to each other. They're two separate government programs, and the only way they talk to each other is when there is one thing in the middle that's uniting them, and that's TRICARE, and we'll get to that in a bit. So now the note that also puts on there is, even though they don't talk to each other, you want to still tell your doctor that you have other health care, because they want to be able to coordinate care. And when that does not mean that they're going to look at what they offered out there and then they'll supplant that. No, what it means is if you got a prescription outside the VA, they want to know about it, because if there's any interaction, for example, with a prescription that they want to give you, then now they're aware, and then they could address it as necessary. So, that you want to tell them, yeah, let them know, don't worry about it. It isn't going to cost you anything, because again, those are two separate programs. All right. The next question that they had was, if I have VA healthcare benefits, should I still sign up for Medicare when I turn 65? I found that a lot of people, when I first became an agent and I started talking to veterans, they would all say the same thing. And I understand them completely, because I was thinking the same thing. I was thinking, when I get 65, I don't have to deal with that, because I got insurance. I got the VA, and it's not insurance. Okay. So the answer that they posted was, yes, we encourage you to sign up for Medicare as soon as you can, for these reasons. And these reasons are crucial. Now, the first one is just pretty straightforward. Having as many options as possible is good. Like I like to say, options are good. If something goes wrong at the VA because it's not perfect, you can step outside the VA. Okay. But listen to this one. Funding for VA healthcare could change in the future. Like right now, they almost had a situation like that. And we encourage you to sign up for every healthcare benefit you're eligible for, so you have options if you need them. And this one is the kicker. If you delay signing up, well, let me change I'm following on a different computer here. If you delay signing up for Medicare Part B and then need to sign up, of course, you have your benefits, your penalties. But here's the kicker. Because you lose your VA healthcare benefits, and that's something that they can't grasp. Not every veteran that goes to the VA is guaranteed to get health care for life because they have what are known as priority groups. And these priority groups decide that if life happened and the government messed up, they didn't get their money and they had to start dumping people, in what order are we going to dump them? And so I think I got this in the wrong order, so I'm going to have to come back to this slide in a second. I want to get to the priority group. So here we are. There are 8 priority groups, okay? And we're not going to go through all the criteria within it, but the most important part here is these 2 down here, number 7 and number 8, okay? These are where you have means tested veterans. So in other words, they're not in there because they had a disability. They haven't been given one yet. They're there because they served. And if they meet the financial criteria, then they will not be turned away because there are veterans who make too much money and they tell them, sorry, you can't come here for health care, which blows my mind. They served and you're going to tell them they can't get a benefit that they earned. But that's a different discussion. So what happens is if they go and cut the budget, and cutting the budget doesn't necessarily mean they're taking money away. It could be that they said we're going to freeze the budget, because of whatever reason. And because the VA plans 5 years in advance and they understand usually what their typical increase is going to be, and all of a sudden they took away that increase for the following year, now they got to figure out where we're going to make up that money that we were counting on. And they'll start lopping off people in group 8 and then in group 7. If they lop off people in group 6, we are in some really bad times because now these are people that have a rating and they have a criteria for getting the benefits. Down here, it's, I can't afford health care, help me. From 6 to 1, it's because of the service that they provided. So when you show that to them, all of a sudden they're like, wait a minute, I can lose my health care? And the bulk of the people are in group 7 and 8, not in the other 6. All righty, so let's go back up to prescription drugs here. So now prescription drugs is another reason that we want to point out to veterans why they need to look at their Medicare plans. Because the bulk of veterans, like I said, are in group 7 and 8. So guess what? What you saw on that page, that groups 1 through 6, I had this little button that said no copays, right? But group 7 and 8 has copays. I know when I was in group 8, I was paying $15 to see a primary care provider. I would pay $50 for what's called a specialist visit. Now, what that means is it's not a specialist appointment. It's a specialist visit. If they could book 2 appointments on one visit, it was still $50, so it made it $25 a piece if you wanted to break it down that way. And then if I had any kind of diagnostic test, MRI, X-ray, whatever, $50. If I walked in the emergency room, $75. If I was hospitalized, automatic $738 and then $10 a day for the next 30 days. So, and then 300, half of it, 300 and whatever half of 38 is, and then another $10 for the next 30 days to give me a benefit period of 60 days. For those of you in Medicare, know a benefit period is a 60-day window. So when you show them, because the majority of the prescription drugs that are given by the VA are going to be generics. Not that they don't give brand names, but they give brand names as a last resort because they're trying to control costs. So the majority of the drugs that they're getting that they're paying copays for, and here's the chart for the copays for 2026. Okay, tier 1 is nothing more than supplements. So, if they give you like a prescribed vitamin D, for example, that's going to be nothing. It's tier 0s for them. Tier 1 for them, okay, is preferred generics, and it's $5 for a 30-day supply or part thereof, $15 for a 90-day supply, and the non-preferred generics is $24 for a 90-day supply, $8 for an 8-day supply. You and I both know that on almost every Medicare Advantage plan out there, these are 0, tiers 1 and 2. So if the majority of their drugs are here, you could show them right off the bat how they can save a good chunk of money every 30 days to 90 days, depending on what prescriptions they're getting. Because if they get them from their primary care provider outside the VA, it's going to save them. Now, fortunately for them, and unfortunately for us, brand name drugs are just 33 bucks for a 90-day supply. And we all know that because of the Inflation Reduction Act, a lot of those tier fours are now 40, in tier three, 47%, which is ridiculous. Okay, so any brand name drugs, tell them, go to the VA. Any generic drugs, bring it to your PCP outside the VA. Save that money. All right. So we're gonna, let me show that like I was pointing out. So you see here, no copay, no copay, but over here says full copay and reduced copay. All righty. Important point. Do not sell a Medicare Advantage only plan to a veteran who has VA healthcare benefits only. Okay. Now, I gotta, say that there are veterans who have VA healthcare benefits and TRICARE for life. Okay, different scenario. When you have that scenario, TRICARE for life is the focus. But right now, we're talking about a veteran that only goes to the VA, like me. I only go to the VA. I don't have TRICARE for life. Okay, and the reason you do not want to put them on a MA only plan is obviously if they go to a doctor outside the VA, then they have no drug coverage. They got to pay cash out of pocket using GoodRx or some other discount card. That's going to cost them. That's going to hurt them. Again, a lot of veterans, they are on a very tight budget. But there is one exception, and let me see, make sure I'm not getting ahead of myself here. Some veterans who have VA healthcare, I already said that. So this is only for those with VA healthcare. But there is one exception, okay? And that is to get them off original Medicare if they didn't choose a plan in time. So how does that work? AEP rolled around, they still are thinking they're what they're thinking, and now they met you. AEP is over. You go into OEP, and now they understand I better take a Medicare Advantage plan because I have no maximum out of pocket limit here. I'm limited to 150 days of hospitalization on original Medicare. I'm limited to 100 days of skilled nursing on original Medicare, and all the other holes that are in original Medicare without a supplement. Because if they don't want to pay Part B, they sure as heck aren't going to pay for a Medicare supplement. Okay? But OEP is only for people on Medicare Advantage. So therefore, they can't change and get a Medicare Advantage plan. But because they go to the VA, and make sure, 1 second here, because they go to the VA, they have prescription drug coverage. Now, even though prescription drug coverage being provided by the VA is not being provided by an employer with 20 employees or more, that's what makes a policy creditable. But Medicare says because the prescription drug portion of the VA is as good or better than what Medicare says it must be, they accept that as creditable coverage. Hence, they have other creditable coverage. So what that means is to stop bleeding, you can go in there and say, okay, I'm going to use it. Used to be OCC, now it's CDC, but you want to check because different carriers may have still be using the old OCC. So look at what codes they have available. And then you put them on a Medicare Advantage only plan. You cannot put them on an MAPD if you use the CDC or the OCC SEP code, it'll get rejected. So once you put them on that plan and explain to them that you're doing this to get them into the Medicare Advantage world, which gives you a lot more options now, because now you have other SEP codes to work with, and then you look for the first opportunity to move them over to an MAPD plan, so now they can get that prescription drug coverage, and they don't have to wait all the way till next AEP to start in January with that coverage. Okay? All right. Now, what are some veteran hot buttons? You want to show them the money because let's face it, that's what talks to them. They're like, I'm struggling here. If I can save a buck, okay, you got my attention. So you want to make sure you show them Part B give backs, over the counter allowances where available, special need food cards. And a lot of these veterans have special needs. Free gym membership, that's huge to them. Global emergency and urgent care coverage. Not even TRICARE offers global emergency and urgent care. They do offer national. Unlimited hospital days versus 150 lifetime. And 100 rehab days per benefit period versus 100 days lifetime. So I don't think I need to recover that because everybody knows their Medicare Advantage plan. So for sake of time, I won't go into all the little details there. And then, of course, dental. And you say dental, you have them at dental because only 1 in 17 veterans that go to the VA get dental. And it's going to be because they are a 100% service connected veteran. And that's it. The only way you get dental otherwise is if there's a medical condition that requires some dental treatment that is causing that medical condition. They'll do that, fix it, and that's it. Dental is over. Or you got out of the military and you didn't get your final dental, treatment. Then they'll say, go to the VA, get it. And now they got you squared away. No more dental. So dental is huge for them. Now, key thing. Well, let me not get ahead of myself. It's on the TRICARE slide, so never mind. All right, so now let's talk about veterans on SSDI. So contrary, like I said, to popular belief, not all veterans get to go to the VA for their health care, which is a shame. And some get denied on technicalities, and unfortunately, some of them they get denied because they messed up. I mean, they got a baked chicken dinner. That's a bad conduct discharge, or they got a dishonorable discharge, or other than honorable discharge. And those discharges, you lose your benefits. So you can't go to the VA. You can't buy a house with the VA guarantee because you did not provide honorable service. And those can be upgraded after so many years of being out and getting, other character witnesses to say that you have changed and so forth. But that's another story. So many of them will go and they'll apply for SSI because they really don't know the difference between SSI and SSDI. And there are many that I've spoken to, and I say, so are you on disability? Yeah, I get SSI. Well, that's not disability. SSI, which is Supplemental Security Insurance, is more of like a welfare program. It's there to provide financial assistance, whereas SSDI, Social Security Disability Insurance, is a medical condition that gets you qualified if you meet also the criteria, which is another training, because within Social Security, there are qualifications to whether or not you qualify for SSDI. Based on your work history. So, and then some of them will apply for Medicaid. So again, they don't know the difference. So we want to educate them on that. Okay. Because if they're on SSI and they have a condition that makes it hard for them to work, then they want to ask for SSDI because not only is SSDI typically going to be more money and may or may not be, because it's based again on your work history. If you're very young and if you only work for 3 years, that means you only got 3 years worth of income in there. And as long as you had 6 quarters paying, taxes, Medicare taxes, then Social Security taxes, then you qualify. So there isn't a whole lot there that if they did the calculations that if you were 67 all of a sudden with this work history, because that's what determines what your disability check is going to be, what your full retirement age amount is based on your earnings record at the time that you apply. So, in an instant like that, they might need to go SSI to get more money. But the SSDI, what that does is, they get Medicare after 24 months. And Medicare is a Cadillac plan, compared to, Medicaid very easily. So let me see. I'm looking at my note here. I don't want to skip anything because I get going and then I'll. One second. I apologize. Okay. Now, you want to manage expectations by showing them the difference because a lot of them believe, I know they've heard, I was told at one point that if you're a 70% disabled veteran at the VA, then apply for SSDI because it's almost a lay me down. And there is some truth to that, but not 100% truth. It isn't guaranteed that they're going to give it to you because the criteria is different. So, and this is one of my handouts that you're going to be able to download, okay? Because whereas with the VA, okay, if you come down here, it says here offers partial payments based on a scale of disability, whereas SSDI it's all or nothing. In other words, if you're not disabled to the point where you can't work for 12 months or greater, then you get nothing. Whereas with the VA, they have everywhere from 0% all the way up to 100% and everywhere in between, based on the scale of the disability, and they give you compensation based on that. Okay, so you want to go over this chart. I'm not going to go over it right now, and because we're running out of time here. But you'll be able to read it. If you have any questions, you can reach out to me for that. Okay, and like I said, after 24 months, they're eligible for Medicare, and because SSDI is usually poverty level income, unless they're a girl that did real well and now their SSDI is above it, then that's when you want to make sure that once they get their Medicare, you apply for extra help in a Medicare savings program to eliminate that 200 and 290, and also get them a food card / utility card to help them with their give them extra money to be able to live off of. But make sure that you explain to them in a nutshell. You don't have to get into all the fine detail, but filial law, which means if you take Medicaid assistance, when you die, if you have any assets that are not going to be inherited, and there are some rules there because you can inherit a house and not move in and still lose it, okay, that they're coming after those assets. And then let them decide whether or not they're willing to take Medicaid because they need the help and that's priority, or no, I'm not taking that chance because I don't want to lose the only bit I got, okay? Do not put them on there without explaining that to them, because when they die, if their family becomes aware of it, they're coming after you because you screwed mom and dad. Okay? All right. So now TRICARE for Life and Champ VA. TRICARE for Life is a Medicare wraparound for TRICARE Prime, TRICARE Select, TRICARE Reserve, and then they got their TRICARE Prime Select overseas. And so there's like 6 or 7 different variants of TRICARE, but they all fall under these 3 main ones here. Okay. And so pretty much it's standard insurance until you become 65. And then all of a sudden it becomes secondary and it acts like a supplement, but it is not a supplement. Okay. So now many veterans believe, again, for some reason that I can't fathom, that they will lose their TRICARE for Life if they take Medicare Advantage. So what you want to do is show them, and there's a link in one of my handouts so that you can actually download these manuals. Right there on the cover, as you're going to see, it has learn how TRICARE and Medicare work together. This entire book, this is page 12 and 13, is all about Medicare and TRICARE. The entire book. You would think that's called a clue, but they still believe that. So make sure that they download the book and say, listen, go to page 12 and 13, and there are all your answers. Okay? All righty. Now, TRICARE for Life and dependents on Champ VA, because, like, for example, if I'm a 100% service-connected veteran, so because of that, my wife gets Champ VA, but I don't get TRICARE for Life. So that's one way a dependent gets Champ VA. If you're a TRICARE for Life veteran that works for the government, your spouse gets Champ VA because she wasn't serving, okay, or he wasn't serving, because we also have women veterans, okay. But if you serve 20 years in the military, then both you and your spouse get TRICARE for life. Okay, so there's a combination, there's a mishmash. So you always want to ask if you're dealing with somebody that has TRICARE for life. Is there anybody on in your household that also has TRICARE for life or Champ VA? Now, you want to be careful because I saw somebody on LinkedIn start posting that, TRICARE for life is a Medicare supplement, and it is not. Now, it acts like one, but it is not. That's a person waiting to get hit with an allegation because they're putting out false information. So you need to understand the difference. It is not a supplement. It's not a plan G. It is strictly a secondary insurance that will cover your costs for medical and hospital only. Ancillary need not apply. Prescription is separate with Express Scripts. Okay. So because it smells like a supplement, and it walks like a supplement, people think it's a supplement. It is not a supplement. Okay. So it will cover all the costs. So it'll cover deductibles, co-pays, co-insurances. Again, does not cover ancillary, does not provide ancillary. And beneficiaries must present the primary insurance card when they go to the doctor, not the TRICARE or Champ VA card. So in other words, if you're a veteran and you went to go see a doctor, you're walking in and you got Humana, you're going to just give them Humana. That's it. But you'll let them know, but I'm also a veteran on TRICARE for life. Because almost everybody works with veterans, so they understand that they have to do a double billing. They bill Humana and they bill TRICARE for life. Okay?
Hey, Eddie, are you accepting questions mid-presentation, or you want us to wait till the end?
Wait till the end because I want to cover it all, and then I'll be more than happy. But you got to ask Michael how much time we got. We're getting close to 11, so let me get through this, and then Michael and Tony will let us know if we're willing to go over the top or not. All right. Now, whenever they have a situation, if they went to the doctor and the doctor says, "Well, we're not set up to bill TRICARE for life," so hence we're going to give you the bill. If you have to pay it up front, then you fill out form DD2642 for TRICARE for life. But if it's for Champ VA, it's 107959A. You could Google these. Just Google Champ VA claim form, TRICARE for life claim form, and they'll pop right up. Okay. And then you submit it and they reimburse you. But many facilities, especially a hospital, is not set up to bill the veteran on the spot. So let them know. No worry. Say, okay, they're going to mail you a bill. You don't have to pay it. You grab that bill, you send it into TRICARE. Let them pay it. Okay. All righty. So TRICARE and Champ VA hot buttons are the same as VA on healthcare. No different. Okay. Important point. If they already have dental, do not tell them you'll be able to save money by canceling your dental, because lots of times that's a family plan. And if it's not a family plan, because today you and I both know that dental with Medicare Advantage, depending on the plans, are all not equal. Some are better than others. So you want to make sure first that the dental does cover their need, because if they have a plan that they've been paying for, they've already met criteria, or they got full comprehensive benefits, you don't want to lose that if it doesn't cover their, the Medicare Advantage plan doesn't cover their need. Okay. Now, if anybody is on TRICARE or Champ VA and you ask them, do you have any family members under 65 that are on TRICARE or Champ VA? Then there is a supplement. It's called Selman Co. I bought it for my wife, and thank God it's not as expensive as a Medicare supplement. I pay like $52 a month, and Champ VA has a $50 annual deductible for an individual, $100 for a family. So it's easy to meet. After that, this pays all of the liability or responsibility of the dependent, because if you're on Champ VA, you're a dependent, or of the veteran spouse, who's under 65. And that link is in the handouts that I'm giving you, and it'll take them there, and they could see everything that it has to offer. Highly recommend you share that information with them. It'll save them a ton of money, because Champ VA is like Medicare, except it's a 75-25, not an 80-20. So it's a higher liability to the individual. So this will make it that they don't have that liability. All right. It's no longer true that you must put a veteran on TRICARE for life on an MA only plan because the donut hole is gone. So you want to do the math, okay? Say, hey, are you paying anything right now through Express Scripts? They say, I don't pay a dime. And you run their information through the plan that you're looking at. If there is no cost, then it's okay to put them on an MAPD if the benefits with the MAPD, with the prescription drug are better than a MA only plan, okay? Because you're not hurting them. And then if for some reason they have a situation where now they're getting more medications, you know, switch them to an MA only plan, have them turn Express Scripts back on. They can do that. Okay. All righty. And I think I already just said all of that. So let me just move forward. So, because I want to cover 100% service connected veterans, because you're finding more and more of these. And because, you know, they pay for nothing. I mean, I'm a 100% service connected veteran. I can go to any ER. It doesn't cost me a darn thing. They do have community care available. And I'm using it right now where they send you out aside the VA to get taken care of for certain things. All my medications are covered at no cost. I don't pay anything for durable medical equipment. If God forbid I needed a prosthesis or hearing aids, it costs me nothing. Long-term care is provided whenever it comes time that I need it. And I get other financial benefits that are tax savings and money for my wife going to school and Champ VA for her. I mean, so it's an amazing benefit package when you're 100%. I mean, you know, but the fact that you're 100%, you know, stinks, but at least they're taking care of you. So it's kind of hard to get them to say, well, I should take my Medicare. Now, the first thing that you need to understand is they don't have TRICARE for life. Okay, they're just 100% service connected. So they must pay any cost share of the plan. So they're saying, why would I want to pick up that cost? Okay, since compensation is over $4,000 a month if you have one dependent, it goes up from there if you have more than one dependent. They're not going to qualify for extra help. They're not going to qualify for a Medicare savings program. Just the fact that they're 100%, you can already eliminate even thinking about those strategies. Okay, and they have dental covered. Okay, I pay nothing for dental. So they don't see benefit whatsoever for a Medicare or a Medicare Advantage plan. So what you want to do is and you're going to get some of them, they're going to see this, and some of them are not. Okay, so these are the four things that you want to share with them. First is having their Medicare Advantage plan will give them access to new treatments not covered by the VA. The VA is notorious for being behind the eight ball when it comes to new treatments that are available out in the community. Okay, so if God forbid you got cancer, the VA is great. I've been going there for 26 years. I got nothing bad to say, but if I got cancer, I don't want to go to the VA because they are no Moffitt, they are no Cancer Centers of America, Mayo Clinic. Just name your cancer specialist clinic out there. The VA can't compete. I want the best chance possible. If they have special needs plans, then obviously getting a Part B give back and adding a food or utility card and typically an over-the-counter allowance is going to negate that cost. Hence, now you have options that makes it palatable for them. Okay, so I'm not paying $202.90, and yeah, I'll have some co-pays, but I'm only going to use this as a plan B. But it's not costing me a ton on a monthly basis because of the Part B give back and the food card and all of that. Okay. Free gym membership and global emergency urgent care. Very, very big benefit. And finally, second opinions for denied care. I mean, where do you go? The VA doesn't agree with you. The VA is not going to shoot itself in the foot. Right. So you got to step out the VA, go see a doctor, and then come back and bring the proof. All righty. So with that, let me just show very quickly my handouts here. So, by the way, so that's my email. That's my phone number if you want to write that down very quickly. But these are the handouts that that Michael's going to be making available. I got the simple guide to the initial SSDI submission process, that chart that you saw that shows the difference between VA disability and SSDI. This here is the one that has all the links to the items I discussed, from Selman Co., Champ VA Guidebook, TRICARE for Life Handbook, and the claim forms themselves, and so forth. And then this is the Adult Disability Starter Kit, so if they need to start a claim, this is what they're going to need. So now, with that, you tell me if I got time for questions, Michael.
Yeah, let's do it.
All righty. Any questions?
There's a bunch in the chat there. Let
Ooh,
me
let me take a
start with, how do we know if they have VA-only benefits?
Oh, just simple. Just ask them. Say, do you go to the VA for your health care? They're going to say yes. And then you're going to say, do you have anything else like TRICARE for Life or Champ VA? And they're going to say no. So it's a straightforward, thing. It isn't like you have to look up anything. They'll tell you that they're going there for healthcare or not. Now, if they're not going there, and ask them, have you ever applied? Because some of them may not have applied. Suggest that they do. Because that's what happened to me. And it was a civilian who told me to do that, not a veteran.
Any other question? Yeah. I think while you were reviewing it, the question came in to provide an example of which scenario an MA only plan is a bad idea for a veteran, and when is a non-dual MAPD the right option, and like trying to figure out the level of what level of service the veteran has if they don't know.
If a veteran has a disability, they're going to know because they're getting paid compensation. And they probably already have a veteran service officer that's also working on trying to get them to 100%, because the way it works is there are certain things that they can tie to your service record. And then anything that is exacerbated by those are called secondary claims. And so you could, some veterans will never make it to 100, but they'll make it to 50%, 60%. And that's money that they get on a monthly basis on top of other benefits and health care. And once they hit 50%, they don't pay any healthcare costs at the VA. Everything is included, at no cost. So they'll know. They'll say, I'm 10%, I'm 20%, whatever the case may be. Now okay, they're going to VA healthcare. And then the next question is, and by any chance, are you also on TRICARE for Life? Because if they did 20 years in the military, they may be. So you want to ask. If they say, no, I'm not, then you say, do you have anybody in the family that has Champ VA? If they're not 100%, chances are it's going to be no. But, it could have been that because they were in the military, they got it for some reason. Maybe they were put out on a medical discharge and they do have it. So you want to just ask. Let's not assume if they're 100% that they don't, if they're not 100% rather said that they don't have it.
Excellent.
Okay.
Hi,
I'm not looking.
hi, Eddie. It's Jackie.
Hey, Jay.
You helped me with a case I had last week where my VA guy was in a rehab facility, and
Yes.
we talked about the fact that he only had 20 days, and um, before he would be kicked out of the rehab facility. And then
Right.
you told me the option that he had with the VA. Do you mind sharing that with everyone in case someone else comes across something similar?
Absolutely. Well, we all know that when you're on a Medicare Advantage plan, or even original Medicare, you only get 20 days in a rehab center at no cost. Okay. So, but the VA does offer options, if you're in that situation. So, like, for example, they do, first of all, have their own rehab centers at VA locations. Often it's full and there's a waiting period, so that you can inquire about that. You also could inquire about aid in attendance, maybe being taken care of at home. Okay. I'm trying to remember everything that I told you, Jackie, because I'm drawing a blank now with everything in my mind. Go ahead and share what I told you to trigger my memory.
Yes, one of the things you told me was that it varies from state to state. This particular client used to be in Illinois. He's now in Georgia. And you were saying how the rules can vary from state to state.
Well, yeah, and the rules, when we're talking about varying from state to state, that's also a Medicaid thing because you can also apply for Medicaid. Medicaid is a state thing. With veterans, it's a national organization, and that's a national, benefit program. So, but a veteran, can also go to the social worker. If you ever meet a veteran that needs help and they have no clue where to start, tell them, listen, walk into an emergency room at the VA and say you want to talk with a social worker. That social worker will start the process, if you qualify, of getting you into the VA, if you're homeless, of putting you in for housing. If you have a condition that requires hospitalization or, maybe some rehab, seeing if there's any room available. If there is no room available, they may offer it at home or in community care. Because if you live 40 miles away from any healthcare center, then you can request community care and they must provide it, which means is that you're going to go to a doctor, a regular doctor that's outside the VA who has a contract with the VA. So there's a lot of options in a situation like that.
Thank you.
Right?
That's what you shared with me about going to a social worker as well. Thank you.
You're welcome. Next question.
Eddie, hi, it's Willie Mae. I just want you to elaborate because when you said go to the emergency room, that's a real point to take in because isn't it true that if you get referred through the emergency room, you get faster service and better attention because you just can't get easy access to a lot of these programs unless you go into a police department or unless you go into an emergency room of a hospital. Can you elaborate on that a little bit too? That's why
When
you
I
go to the nearest emergency room.
when I was saying emergency room, I was saying go to the VA emergency room. Because if you go to an emergency room of a regular hospital, you can ask to speak with a social worker there, okay? But that social worker is only going to tell you you need to contact the VA if you're a veteran. They don't deal with the VA, okay? So, like in my area, we have Bay Pines, and in Tampa Bay, we got 3 VA hospitals. We got Sarasota, we got Tampa, and we got Bay Pines. So there are a lot of options. Where you're at, you may not have that option, but you might have a clinic. So you can go to the clinic and whatever VA service or I'm trying to look for the right wording and I'm blanking here. Facility. There we go. That's in your area. If there's only one, then they are going to provide all those services in that area because they know they got to cover a certain region that does not have a hospital nearby. So you want to go there and request a social worker. But the best is if you can actually go into a VA emergency room because you're right, Willie Mae, they act fast. If you didn't do it that way and you decided I'm going to go over to the VA administration's building and make an appointment to go see a social worker and you're walking in off the street, they don't see emergency. They're just going to start the process and it could be a slow walk. So I highly recommend go to an emergency room, especially a VA one. Ask to speak with the social worker. Let them know that you're homeless. Let them know that you're hungry. Let them know that you have a medical condition. And if you don't have VA, they'll put you in the system right there. And all of a sudden you got VA healthcare. Next question.
Eddie, there's a question about National Guard coverage in the chat.
Unfortunately, that's a travesty. Yeah, National Guard, for some reason, they don't consider them regular active duty veterans. I got a client who's a National Guardsman. He's not allowed to go to the VA because he's a National Guardsman. But see, there's the Army Reserve National Guard, if I understand this correctly. They are considered veterans. But then you have all your National Guards that each state has, and those are not. So unfortunately, if you fall into that, then you can't go to the VA for it unless you were serving during, like, for example, Desert Storm. When we went, they activated a lot of National Guard and a lot of reservists, and they made them serve. In that case, because they served during wartime or a war or conflict period, they don't have to actually be in country. Okay, but if they were activated, then that's considered serving. Now they would qualify. But absence anything like that, because they are National Guard, they do not qualify.
Well put, Eddie. Thank
Ne-
you.
Next
I have a
question.
question. My name is Loretta Lee, and I'm
Hi,
new.
Loretta.
Okay, hi. And I have a
Welcome.
question about the TRICARE and life for life. Is that a I mean, is that an extra insurance? Is it like a Medicare? I don't know what the
No.
TRICARE for life is.
So TRICARE for life, a person had to already be on TRICARE. So imagine that you were on, and this is probably a terrible example, but you were on Blue Cross Blue Shield, regular insurance, and then you turned 65. And you decided you want to stay with Blue Cross Blue Shield. Well, the plan that you had before is not the plan you're going to have with Medicare, because those are two totally different beasts. It is going to change to whatever it is that Blue Cross Blue Shield offers with Medicare or for Medicare. Understand? So TRICARE, what it does is, and to put it in plain terms, it was a standard insurance policy where they were covering everything, until you turn 65. And then all of a sudden at 65, they say, hot dog, they're going to get Medicare. So we're going to tell them, if you don't take your Medicare, Part A and B, then you're going to lose your TRICARE. So, do you want to be without insurance or do you want to have insurance? And of course, everybody says, oh my God, I better get my Medicare. And so now they're happy because they only got to pay 20%. Okay. Whereas before they were paying 100%. So therefore, they'll take that all day long. Same thing with Champ VA. So it becomes a secondary payer where it is not your primary insurance, but it's meant to cover your liability only for medical and hospital. That's it. Prescription drugs is separate. Ancillary services are not included.
Yeah, I have a question. This is
Okay.
Zena Moore. I have a
Yes.
question. So if a veteran who has 100% disability and about to age into Medicare has a Blue Cross Blue Shield, um, they would still would you recommend that they still get a Medicare Advantage or Medicare
Well,
supplement?
no, absolutely. Because see, okay, now does this person have TRICARE?
No.
Okay, so they go to the VA for healthcare?
Yes.
Okay. Yes, absolutely. I recommend it. And I recommend it for the reasons being that, first of all, he paid for it, or she. Okay. So it has a lot of value. It gives them, that other option. So if they needed to step outside the VA, they could and not get stuck with something. If they're not 100% service connected, if they went to an emergency room and the VA says, sorry, you don't meet the criteria, we're not paying, they're not stuck with that bill. Just pull out your Medicare Advantage plan, pay the copay, and you're done.
Well,
So
this person is 100%.
okay, so here's 100%. So then you want to go to my last slide and share with them these points right here and see if he or she agrees, because obviously they're going to be the ultimate say. We're not here to strong arm them. We're here to educate them. And so just let them know, say, listen, the reasons you want to get your Medicare and you want to be on a Medicare Advantage plan is, first of all, there are plans out there that are going to give you back a portion of that Part B, depending on where you live. It could be anywhere from $50 to $185. That's the high this year. We could try to look for one. And if you have any special needs, like you're diabetic, for example, if you take a beta blocker, that qualifies as a heart condition, and you qualify for a C-SNP. Beta blockers like metformin, metoprolol, and there's a bunch of them like that. And so therefore, You don't have to worry that you're paying 200 and 290. We can get you a food card that will supplement, the rest of that cost because you're now taking the money from this card for food instead of out of your Social Security check. You have over the counter, same situation where you don't have to, use your own money to buy your toothpaste, soaps, vitamins, shampoos, whatever the case may be. That's money that stays in the bank. So we're helping to cover that cost. But the reason this is important is because if God forbid life happens, you want another option. And Medicare is a huge option. Now, I like to tell people my mom got for two hospitalizations a $496,000 evidence of benefits. Okay. And I was like blown away. She was hospitalized about a dozen times since she was living with me. And she was on Medicare for 15 more years prior to getting to me. And just those two was $500,000. How much money did Medicare spend on her health? Okay, that's a huge benefit. You do not want to lose that. The free gym membership alone says, obviously, if you're going to stay fit, that's going to help you stay healthier. But gym memberships nowadays run you anywhere from, on average about $50 a month. Because if you go to a UFit for $10, you got to pay extras. But that's a free, a free service that's going to save them money. So show them these benefits and then let them decide whether or not that has value for them. You're not going to get all of them because some of them are just going to say, well, I'm not going to do it because I don't want the bill and I feel I'm covered. And that's okay. Just say, if you change your mind, give me a call. Did that answer your question?
Hi, Eddie. It's June. I have a question. Can you get into a veteran into an MA plan during OEP? During OEP.
Okay. So if I understood your question, you're saying, can you change them or put them into?
Can you put them in? Is there, unless, in other words, the only way you can get them in during OEP is if they have diabetes or DSNP, right?
Well, you're right. You got to find an SEP code that is not OEP because if they're on original Medicare, OEP does not work for original Medicare. So if they have a special needs plan, you can use CSN. Hey, they got a special needs. That'll open the door. You can use the OCC, CDC, other creditable coverage as a last resort because that'll open the door. If they moved, okay, that could be an opening by using Move, MOV, and that opens the door. So the point is that OEP cannot be used because they're on original Medicare. And sometimes these other SEP codes are not available. So when they're not, that's when you want to click on, you want to use CDC or OCC and put them on an MA only plan and then look for the first opportunity to switch them to an MAPD.
And just the other thing I want to clear up in my mind is that if they're 100% disabled, they cannot go to any hospital that they want to oversee what the VA doesn't know how to do.
No, the only way they can go to any hospital is if it's an emergency situation. So if they have, they were in a car accident, God forbid, they fell down, broke a leg, fell out of the tree, they're having a heart attack, God forbid, any emergency room will do. And just when they get there, say, I'm a veteran, I go to the VA. That's all they got to say. They will contact the VA. And because they're 100% service connected, they're not going to pay a dime. Now, if they're not 100% service connected, now it comes down to what is the situation? Is it connected to a disability? If not, is their life in danger, health or limb? And we agree with it. So that's when it can get murky. And that's why having a Medicare Advantage plan in your back pocket to save you financially is important.
Okay, great. Thank you so much.
Hey Eddie, really quick. This is Theo. So I have a client. She has TRICARE for life, and she recently sent me two forms. One of the forms simply saying that TRICARE for life, we have records that indicate you have other health insurance information through a Medicare Brave and Health plan, and it looks like, and it appears as though TRICARE may have overpaid. So they want her to fill out this form. And then the other form was just stating that our records show that we may have inaccurate information with other health insurance records. So please fill out this form. So I guess you kind of answered my question with some of the things you stated. But so can we assume that every time someone has TRICARE for life and we put them on an MAPD plan, they're going to have to submit these claim forms to TRICARE for life since TRICARE doesn't speak to MAPD plans? Is that kind of how it works?
No, not necessarily, because
Okay.
many doctors, they already have systems in place because they've been working with veterans. So they automatically know this part goes to Humana and this one goes to TRICARE or Champ VA, and it's all done for them. But sometimes you're going to find people that have antiquated systems. They didn't upgrade their computers, so they're not all set up to do both. It's called third-party billing. Okay, so then in that case, they're going to either say you're going to pay me now. Let's say it's a copay, because obviously if you got an MAPD plan, it's going to most likely be a copay. So let's say it's a $50 copay for a specialist visit. So you give them the $50. Then you fill out the form and you submit it and get your $50 back. But now, sometimes they're not going to bill you there because maybe they got diagnostics, they sent you out to a different location, and they're going to send you a bill. They're going to send Humana a bill, and you're going to get your portion, your responsibility. So when you get that, then you submit that to TRICARE, because since obviously you haven't paid and you got proof of what is owed, let TRICARE deal with it. Just submit
Got
it.
it. Yeah, because from the email, it looks like TRICARE may have overpaid. So I guess they're looking for some sort of reimbursement. But yeah, that makes sense.
And if they overpaid, the reimbursement does not come from the vet, it comes from whoever they overpaid.
Mm-hmm. Got it.
Add a couple more in the chat. If a beneficiary has TRICARE or Champ VA, they have premiums, right? They should definitely know that they have those benefits,
Right.
whether
If
or
you have
not they get a
Champ,
card. Yeah.
right, if you have Champ VA, there are no premiums. That comes because it was earned. TRICARE, I was told by certain people they pay nothing for it, and I've been told by other people they do. So I guess it depends on which flavor you got. So, like for example, if you got TRICARE because you were a government employee, you might be paying a premium. If you got it because you served 20 years in the military, you may not be paying a premium. So I don't have a 100% concrete answer on that. If they don't know that they have TRICARE for life, ask them, did you have TRICARE in the past? TRICARE Prime, TRICARE Select, any of the variants of TRICARE? If they said yes, I would tell them, contact them, because you may qualify for TRICARE for life and not know it.
Okay. Last two here. So when a vet turns 65, are they supposed to sign up for Medicare, or they have to option not to? They have an option not to.
Well, nobody has to sign up for Medicare if they don't want to, but they should sign up for Medicare, yes. And we encourage them to do so because you don't want them incurring penalties. I had the highest penalty I got was from one veteran who came to me with 120% penalty. I mean, there's no way he can afford even with a Part B give back. Okay, so and on average, I get 50 to 70% penalties from people who kept hemming and hawing. So you want to let them know, you need to take this because of this. And if you're fearing the 20290, let's talk about it, because there are ways that we can work around that. Let's see if you qualify for those ways.
Okay, great.
And then look at a Medicare savings program, look at Part B give backs and stuff.
Excellent. Okay, then the last one. Is it not one day active in a wartime service anywhere that these people are eligible, basically?
No, that's for a veteran's pension. So if you, and that also, I guess, would qualify you as well, to get into the VA, absolutely, yes. But that criteria is typically used if you want to request a veteran's pension, that you had to have served at least one day during a conflict or active war period. And it doesn't mean that you were in country, you were just in the service while this was declared.
Okay. Oh, one just came in. What if they're dual and they're going to the VA?
Well, if they're dual and going to the VA, then they got even better options because they're not paying anything at the VA, most likely if they got some disabilities, and they're not paying anything outside the VA. And if they're dual, they're probably not paying anything in the VA regardless because they're means tested.
Right. Which you covered that earlier. Okay, great.
Yeah, it's just another option with better benefits.
Beautiful. Any other questions for Eddie?
Eddie, I just wanted to just say to you, you're doing an outstanding job and we need an encore performance. Thank you so much, Eddie.
Absolutely. Thank you, Eddie.